Hi, and welcome to 2021 spring term for the Pharmacotherapeutics 1 class. This is my second time in this class, and it is considered by several people, or at least one person specifically, that this class sort of runs by itself. This class does need a little bit of updating still to happen. Um, some of the materials that you have on Signet, and I am going to pull that up in just a minute, but I need to pause. There we go. I think you should be seeing this. I'm not exactly sure what you're seeing on the screen. And I'm going to do this. I think most of you actually, I'll keep my head up, my talking head in the corner because I'm not sure I know all of you. Um, so I'm on campus most Thursdays and Fridays and some Tuesdays, and I'm more than happy to meet on campus. I'm also more than happy to meet online. Um, I do these little visual graphics, which here I'll just kind of show you. Like, here is ours right here. It's very quick for me to see it. Plus, this is a really interesting article. And I thought that the parameters of the article were very effective. Now, the rubric for us assessing your prescriptions was written by Dr. Smith, so I don't think I can change it, but I have made one based on the um, article. So here is our syllabus. Our syllabus basically falls with the same topics that is listed on the NPLEX blueprint. And I think that's very effective, but what that also means is you're learning drugs by silo. You're not learning them in really good case-based information. And that's why we have these prescriptions, these small cases where you will do a prescription, you will include some other information, but I do want you to have the parameters as if you were actually giving a prescription to a pharmacy, which does have some legal requirements, just like you will have legal requirements in whatever state you were practicing in. In Illinois, we don't have a practice act, so we do not have legal requirements because it is not legal for us to prescribe medications. But in the state of Washington, there's certain things that need to be included, especially if the script is on paper. Once you put dispense as written on your paper, then it actually changes the requirements as well. One of the pharmacists in Washington State had told me that when I tried to fax a prescription and then called them back and talked, a pharmacist is your friend, and the compounding pharmacists are amazing. Now, compounding pharmacy and the medications they will make and dispense for you are often off label for FDA, and most of the NPLEX list will be focused on label. And that is very easy to find the doses. I would actually recommend that you look at a database. Like, here, why don't I pause this for a minute and show you one of my databases? Ooh, that is nice. Oh, man. Here we go. All right, so this is one of the databases I use. I paid $40 for a year, and teachers sometimes get a very small stipend. Stipend's not the right word, expense that might be given back to you. And this was low enough that it seemed pretty reasonable. And I really do like this. And I was just mentioning, I think, to the Pharm 2 class in their introductory video. The Davis Drug Guide is something a nurse can use in an inpatient facility. And an inpatient, that nurse is dispensing the medications and evaluating for side effects. Those are really important things. And side effects are something that I think are really important for you to know. So I used to buy a used drug book, which, they're small. They're not small enough to fit in a white coat pocket, but they're definitely small enough to be inconspicuous on your desk or counter. I used to also like drug books, bot med books by that, like the green spiral bound bot med book. Excuse me. Um, the drug books are actually a little bit smaller than that. So Davis is one that's very popular. Lippincott has one too. There are many, and there are some at the used bookstores. Um, Now they probably might not be as up to date on the SGLT2, the Ozempic, etc., weight loss diabetic drugs, but they will be in there because those drugs have been around since 2015 because I know I was adding them to endocrinology at that point. So I'm just going to show you, here I've always, atorvastatin, it's a statin, and it should pull this up. So it has a nice list of things that will be on here. Here's what it looks like, which is not necessarily what we need. And it's telling me I need to sign in. And of course, I will sign in and it should automatically sign me in. So here's the therapeutic class and a pharmacological class. So we would call this a statin, and that's what an HMG-CoA reductase inhibitor is. It's a statin. Which lower lipids, but there's other classes that lower lipids. And here I am, you know this information, but I really like this for the pharmacokinetics. And then it has a great list of cautions and things like that. And this drug-drug interactions, when I am making new notes for the pharmacotherapeutics and pharmacology classes, I go to this list first because I do think it's a little bit more comprehensive. Because again, this is something that nurses have to be mindful of. So I'm going to stop that share. So there is references for you. Those references, the course pack, and I think I can't remember if I added more or not. That's from 2017, and the NPLEX list has changed. I do think there are more on the NPLEX. So the NPLEX list, there's the core list and the elective list. And the elective has more. Now, what I was told last term and what I thought happened, and I asked and I was told that the elective list is just the core list with other medications. And that's not necessarily true. The core list has a few things, including some OTCs that are not separated. The elective list for NPLEX has the OTCs at the end. I put all of them in a spreadsheet over the Christmas break. I started working on it around the Thanksgiving break. I think at my last count, there was 302 unique medications on both of those lists combined. That's more than you need to know for botanicals by far. Now, the thing is that we do have a lot of very specific information about drugs. You can just look it up. Whereas a botanical, you have to really think about things because remember, like here we have atorvastatin, I just showed you on the screen, it has one specific, very direct mechanism of action, whereas botanicals are multiple compounds and have many different uses and actions. So sometimes when we think about these things, like people don't like drugs, but in essence, pharmacology, once you're just talking about the drugs, it's not that difficult because there's so much out there. Learning the botanicals is kind of hard. And then thinking about a patient in front of you is kind of easy because you have these ideas already. But if you're faced with a paper case, which is what our class is, you will have to think, well, what's the most pertinent thing to treat and what is that pharmacological class? You must give a pharmacological class, pharmacological agent from the NPLEX list. And not a tincture to get credit in our class. Let's see, I don't know. I'm gonna go back to the syllabus for a minute because that's still up here. And I didn't write the syllabus or have anything to do with it. Okay. Because this is not necessarily my style of syllabus. So the weekly assignments There is a case, but that is what this is. So I'm not going to separate that and highlight it too significantly. So the short cases are the prescription, the weekly assignments are forums. And then there is also a quiz. I don't know why that's not here. So let me actually see if I can, that's weird. Sorry, I'm taking so long. Oops. I did exactly the same thing because concourse is kind of weird this way. There we are. I thought I saw it. Okay. So there's lots of things hidden because it's not necessarily my class. And here is your quiz. Here is your case. And then here is a forum. Here, it's a little bit better this way. So the forum, you interact with each other. The quiz you do on your own. You have till Sunday night, 11:59. And the prescription exercise is due at the same time frame. All of this is due Sunday nights. The prescription is the prescription. I do want you to have the pertinent information, and I also want you to have pertinent information about potential side effects. And contraindications. Are the contraindications present? Then you can't prescribe it. So just things to think about there. And I know I'm going kind of fast. I think last term I lost my video for this, and I'll just stop there. Taking on the pharmacology classes has been an interesting experience, and this class in particular has been an interesting experience just because the class was created by a former pharmacology teacher, Dr. Daniel Richardson, who was a Pharm D and passed away right before COVID. And we loved him. He was an amazing man. And so it's kind of hard to see that some of the work that was involved with him and his TA needs to change. And as somebody that's a naturopathic prescription, you can hear I'm not, my congestion is getting in the way of my voice. So I was practicing primary care in Washington State and in Oregon, and I prescribed a fair amount. I took over prescriptions, sometimes very intensive prescriptions. I am no longer renewing prescriptions for patients. I stopped doing that last month. I did check in on one of the patients just to make sure they had a provider to take over those new prescriptions, because I don't want to leave somebody hanging. But I feel like a naturopathic doctor who wants to do that is great. This class is great for you. If you don't want to do that, I still want you to support the professionals who do want to do that, because naturopathic medicine can be elite. And the patients that I saw were mostly on Medicaid, and they loved seeing NDs, and they were so grateful to have that option. Of course, it doesn't provide a lot of money to the provider, and you have to fight with the insurance companies. But I want all of you to feel comfortable doing that if you choose. Who knows what's going to happen to insurance and medicine in the next few years, and maybe it will be beneficial for patients and providers. But I don't think the pharmaceutical industry is going to ever completely go away. And I think some of these medications are able to be used safely. That is where I will leave you. So those of you who don't know me, I am Dr. Lorinda Sorensen, and I look forward to working with you this term. Thanks. Bye-bye.